All right, Doc, I'll let you take this one because there's a lot of text.
Another long one. Okay, so this gentleman says, first and foremost, I want to thank you for simply taking the time to review this question and information. I've personally tried to book an appointment with a doc. I live in California and work for the Department of Corrections, but scheduling has always been an issue. However, following his advice, I've been able to drop my cholesterol, estradiol, blood pressure, and liver enzymes near optimal levels on a TRT dose of 200 milligrams of test weekly, and every so often I will add some tren, enanthate, and masteron. Enanthate?
Yeah.
However, the question and information I'm asking is not for me. I'm currently dating a 35-year-old woman that has just been diagnosed with Ehlers-Danlos syndrome. At the time of this email, they are assuming and we're hoping it's only type 3 and not type 4, the vascular type. I have very little medical knowledge, but have spent almost 8 months researching treatment options here in the States, Europe, and in Canada, which she is from, British Columbia to be exact. In 2014, she had to have ACDF surgery, disc replacement, fusion. Because the disc and connective tissue are simply damaged. Her quality of life from that surgery has become a 180. This was an independent woman that the world was hers to own, and now the doctors do for her is palliative care. Opiates for pain, NSAIDs for inflammation, antidepressants, etc., etc. Yeah, that didn't sound good. From the research I've done, there's no cure. Genetic malformation that causes the loss of connective tissue. I've been to Ehlers-Danlos syndrome webinars with physiotherapists that recognize the need to strengthen muscle tissue to compensate for what the tendons, ligaments, and other tissue aren't doing. I've asked MDs if a supplementation of anabolics, HGH, or peptides would help. It's an area that they wouldn't even consider talking. I've talked to a friend of mine and he suggested to ask a DO because they simply have a different way of treating a patient as a whole and not the ailment. And in the past, my DO put me on a low dose of DECA for a short period of time while recovering from a rotator cuff injury, and he put my ex-wife on 50 milligram dose every 10 days of DECA to help her fibromyalgia, which did wonders for her. Both of those make sense for a while, by the way, for a good reason. Now my question is this: in your medical opinion, knowledge, or experience, is there anything such as low doses of equipoise, decadurabolin, primobolan, anavar, HGH, or peptides that will not only help her strengthen her muscles that literally are atrophied from the surgery in 2014 and help her be more independent, and most importantly, anything that might aid in building or strengthening that connective tissue, even if minimal at all? I know she will never be the woman I met prior to 2014, but I want to make sure that the rest of her time is enjoyable and can do the small things she used to do, like go for a walk and not be bedridden for 3 days. I appreciate bro science as much as the next person, and forums have been talking about taking anavar 5 milligrams a day for muscle synthesis and connective tissue strength. But I'm crazy about this girl, and I'd rather have an expert, knowledgeable person give their opinion and advice. I understand that none of this constitutes medical advice. But if you happen to have any studies linking effects of anabolics, HGH, or peptides, or anything else to improve quality of life, please direct me to them. I will fly to all her medical appointments just to let them know that other options are available. Thank you so much. I know this was a bit unorthodox, but I figure if anyone could lead me to a closer answer, beneficial or not, then it would be you. Thank you, Dave and Doc. David Silva. Well, first of all, thanks for trusting us with something like this. And yeah, you're right. I mean, this is complicated. So again, I can't give you medical advice. This is just be general, but I'll give it a go. I mean, I think there's I want to say 13 different types of Ehlers-Danlos syndrome.
What is that?
The most talked about symptom of Ehlers-Danlos syndrome is hyperflexible joints. That's what's seen most often. Also, the skin can be really hyper flexible. You can really stretch it far. You see, not like Dizzy Gillespie from blowing the horn all those years, but just just being able to pull it. Also, much more easily bruised though when you do something like that. The skin can often be really velvety, soft, but fragile too. But it's hypermobility of the joints is the typical. But he mentions he calls it type 4. I didn't know they actually typed them, so I'm a little bit out of the water. My own element here with that. I know there's different classifications. Again, I think there's 13, but I didn't know they numbered them. It's not my area of specialty. But yeah, the vascular type can be much more dangerous because, just doing heavy squats, you could blow out the veins. I mean, that's obviously no bueno, or any of the vasculature, not just the veins, any of the cardiovascular system. So, I hope it's not that one, but it doesn't mean you can't do anything anymore. You're just not going to be doing heavy squats and deadlifts. You can still do, some bicycling and other activities, because you need to stay healthy. But yeah, I mean, there's some different things that are of concern with, we'll call it ED for short, not erectile dysfunction, Ehlers-Danlos syndrome. So I don't know of any studies which will show that you're going to improve connective tissue strength, certainly by doing anabolic steroids or growth hormone necessarily, but common sense for what that's worth in medicine, not a whole lot necessarily, more often than not, believe it or not. But as we mentioned in an earlier question, anything you can do to strengthen the joint, keep it more stable would be helpful. So again, barring that she has the vascular type, which would really preclude at least heavy lifting, you'd have to be more careful with the lifting. Then yeah, it would make sense to strengthen the musculature, certainly around the joints, to help keep them from being as hypermobile. And so yeah, that makes sense in that regard, to increase that, to leverage that ability to do so, to make muscle numbers, to strengthen the muscle with an anabolic steroid. That makes sense. 35 years old.
Yeah, it sounds to me she can't even get out of bed for 3 days. It's pretty bad. So
well,
no energy.
Okay, let me segue to that too. And believe me, this is a tough one. I think in Chris Bell's movie, I think the only thing they included for me, the only thing that didn't make the editor's floor was my comment about, with the use of opiates, you're in a tough jam because you don't want to be insensitive to the pain. And it's all we got really for it's not all we got, but this type of pain medication, opiates, is really all we got in terms of, hey, here we can dish out in a pill. And it comes with so many side effects and risks, and yet, you don't want to hand them out like candy either because of these side effects and the risks. But again, so you got to weigh this person's in some pain here, and you got to be compassionate toward that and respectful of that, but you also don't want to send them down a rabbit hole where, I can think of so many examples. I have a friend who's one of the best masseuses around, who used to work at the Russian College of Sports Medicine. His son died at age 27, arguably because of the painkillers for, he had a spinal injury, and it was very, very painful. And again, I don't know how painful. I wasn't in that car accident. I didn't have that damage. I didn't have his genetics and his pain perception, all that kind of stuff. But it definitely didn't help him, and it definitely furthered his demise. And of course, all the side effects that come with it. So anyway, without getting I don't want to be preachy at all. I just want to explain that I want to preface my comments with an understanding of both sides of that equation. But yeah, I also didn't she'll never be the woman she was before that. Well, she had ED before, and she still does. She's always had, if she's not the woman she was before, well, what's changed? Well, was it the fact that we're jumping on all these painkillers? I mean, again, not to be insensitive to the pain, but what made it more painful all of a sudden once you got the diagnosis? She was living with it for 34 years, before the take-home message, without getting too preachy and going on and on about it, is be careful with painkillers. There's a reason why they call them killers, in my opinion.
Mm-hmm.
Sure, now everyone hears about the opiate scourge and the epidemic and how it's killing everybody and whatnot. Again, there's a place for these meds, but be careful, because it sounds like she was going along pretty well before, and like what changed to make her bedridden now and all this stuff. So again, I don't mean to step out of line, and I'm giving a general response. There might be things I have no clue what I'm talking about here, and they go, hey, if you knew this, you wouldn't be talking about pulling the opioids. She probably needs more than she's taking. I don't know.
Yeah.
But Yeah, be careful with those though, and antidepressants aren't harmless either, despite what people will tell you. We're reading more and more about that. Nor are NSAIDs. They can wreak havoc on your GI. They can wreak havoc on your kidneys. So, again, use those sparingly, only as needed, I would argue. As far as the use of growth hormone, again, only as it would help to strengthen a damaged ligament or tendon. I'm not sure this would classify as a damaged ligament or tendon. It's a pathological condition of it's a syndrome, or it's a what did we call it? Yeah, a syndrome. And we don't necessarily know what's at the root of it. Certainly, if she has damage, the presumption would be that it does help heal, like all growth hormone would help heal the ligaments and tendons. So yeah, it might be a good adjunct. And again, the anabolics would make sense to strengthen the muscles if she can do the weightlifting. Peptides, yeah, there's some good peptides too. Some of which are known, but at least in the U.S. aren't legal yet. I'm pretty sure BPC 157 is not legal here in the United States. But there are some studies showing that it can help regrow tendons. I know that there are guys that are involved, the world strongmen, the guys that throw beer kegs over walls and stuff. I can remember 10 years ago hearing from some of those guys that use of BPC 157 was a lifesaver.
Wow.
They would inject, twice daily. They wouldn't inject in the tendon. They go either side of it. And then, of course, there's the animal studies which show it's the best thing since sliced bread.
Wow.
I think if you go online, there's more and more access to these. So maybe they are legal. I have to check. But more and more people are using them with great success.
Wow.
I'll spare you the monologue about where BPC 157 is derived and all, but it can help with your gut. It can help with in her case, I don't want to get upset. It might be helpful for tendons and ligaments. Is it gonna act as a treatment? I don't think we have enough knowledge about ED to know what its cause is and therefore what its treatment is. But treating the symptoms as opposed to curing it, I can't tell you for sure, but it might be helpful. Anavar would be a good choice for a female because it's a DHT derivative, will not convert to estrogen, but it's very anabolic without being very androgenic, meaning it won't produce the typical male secondary sex characteristics of
nice. Hair
in the wrong places and losing hair from the right places. Yeah, thickening of the voice, the thickening of the vocal cords. Decaduroblin, nandrolone, primobolan, anavar, those are all DHT derivatives and probably a better choice than equipoise, which is really very close to Dianabol, which is not a good choice for a female. The only one that's legal here in the United States would be Anavar. So, or Nandrolone, and I'm not sure where Dave's from, or his girlfriend's from Canada. So
yeah, I think
he's from Canada.
Yeah,
those things legal there either.
I'm not sure. I left so long ago.
Well, anyway, I don't need to get into too far into the practical. I know you're asking for the medical, but it does come into play. As far as the atrophy goes, obviously the anabolic steroid is for atrophy and I would think could only help.
Yeah.
The reason why the nandrolone, the decaduroblin, might be a good choice also, and why it probably worked well for fibromyalgia is because it does help with pain. It is not going to heal a joint. That's physiologically impossible. An anabolic steroid doesn't create, synovial fluid or cartilage or anything like that. It doesn't heal a ligament either. But it does help with pain, and we've talked about this before about how nandrolone. Oh, it's great for healing your shoulder. I'd use nandrolone, all my shoulder pain goes away. No, the pain goes away, but it doesn't heal your shoulders. Not because it's healing. It's not fixing your shoulders because it's just getting rid of the pain.
I never knew female could use it though. That's new to me.
It's very it's a very unique anabolic steroid. It's probably one of the we call it a NOR19. It's a very unique anabolic, but it it's not one of these DHT derivatives, but I don't know how to say it any more than it's very unique. It won't convert. I mean, I think a small percentage, roughly 20%, will convert to estrogen, but it's very anabolic without being androgenic. With testosterone, you have the conversion to dihydrotestosterone, which is 2 to 5 times more potent than testosterone, depending on which receptor we're talking about as being activated. Whereas dihydronandrolone is very, very, very mild, much more so than dihydrotestosterone, which is one of the reasons why males will suffer a form of erectile dysfunction, which has a funny name attached to it based on the old brand Deca. But that's the reason for it is the very the mild nature of dihydronandrolone. So it's very safe for a female.
Wow.
Not often used for a number of reasons. I don't know if it's legal in other countries, but it is legal here. It's just not typically prescribed for a woman.
Do you think it would really help with fibromyalgia?
Well, it could, in the fact that if someone had other needs for it, meaning they had low testosterone and some atrophy, they're underweight, they had a wasting disorder, and they also had fibromyalgia, well, you're killing more than one bird with a stone. And again, because of the pain reduction from
Nice.
the progestins that are created from nandrolone metabolism. I think I got everything on there. So he's asking about Anavar, 5 milligrams a day. Probably not a strong enough dose for replacement, and eventually, you could add that, but it would have to be for a short term. But remember, it's going to stop hormone production, so you'd probably have to use more than that for a replacement dose. Closer to probably twice that, so 5 milligrams twice a day, perhaps.
Yeah.
And she's already 35, so by definition she's perimenopausal. So obviously, be a good idea. I know I'm stating the obvious, but I got to be careful because I don't want people to again. This is generalized information, not medical advice.
Yeah.
But you want to get labs first and see. Okay, well, what's your testosterone level at right now?
Yeah.
And maybe this would be a good form of replacement for it. And replacement might be a good idea no matter what anyway. Adding an anabolic on top of that, or instead of, it might be a good idea for the reasons I mentioned. So androgen, anabolics, HGH, and peptides. Other peptides, what they're calling TB500, the thymosin alpha 1, or no, that's thymosin beta, sorry. That might also help because it works on muscle tissue, the actin. That I don't know. That would be strictly off the top of my head, theoretically possible to help. Again, you'd have to find it. I don't believe that's legal in the United States. It might be in Canada.
Mm-hmm.
But I'm just going on, what I read because I hear about these things all the time, obviously, and want to know what the heck is out there thus far. But I'm pretty sure that is something you'd have to find in a country where it's legal. But again, I don't have any proof that that's been used to treat ED in her case. But again, at this case, I totally sympathize where you want to do whatever you can to help, and with very little downside. Is I think the implication here is that any of these recommendations would be things that they're not going to do any harm first
Right.
do no harm, but they might be helpful. They might not do anything, but I can't imagine that anything that you use that would be helpful in strengthening the muscle around the joint wouldn't what wouldn't be good about that,
Right.
So God, best of luck in that regard, and if there's anything else I can do. Says that he's local here. I mean, again, if I don't know much more of what I can say without more information, and even with more information, I might not be a help. But I'm here if you want some more help of any.
And please let us know if any of this stuff helped. We're interested.
No, of course, yeah,
always.
sure.
Thank you so much, Doc.
Thank you.